Well, the country may be one step closer to getting a third coronavirus vaccine. Johnson & Johnson says data from a late-stage trial shows that its single-dose vaccine works.
That vaccine was found to be 72% effective here in the U.S. when it comes to preventing moderate to severe disease 28 days after vaccination. But it was only about 57% effective against the South African variant. Joining us now is Dr. Suman Radhakrishna, Director of Infectious Disease for Dignity Health, California. Thanks for your time. And can you put this in perspective for us? Let's start by comparing the effectiveness of the Johnson & Johnson vaccine to the Moderna and Pfizer vaccines.
Thank you for having me. And yes, we have now vaccines that have been produced in many different ways. The Moderna and Pfizer vaccines are the mRNA vaccine, and the Johnson & Johnson is an adenovirus vaccine. And if for people who have problems with significant allergies and anaphylactic reactions and they're afraid of taking the mRNA vaccine, this is a good alternative. We have to remember that vaccines were supposed to be considered effective if they were more than 60% able to curb the spread of infection, which it has. So it has met the goal. We wish that it was at 100%, but 66% is still higher than 60%. You have to understand that. The vaccine was also made, or at least the formula for the vaccine was derived when we did not have the South African strain. And that's the reason why the susceptibility is dropped, because the South African responsiveness was significantly lower and it brought the percentage down. What this vaccine shows is that people are less likely to have severe disease. So that's still a big plus. Remember, we're in a pandemic. The first thing we need to do is halt the spread of infection. And the second thing we need to do, if we cannot 100% halt the spread of infection, is to reduce severe disease and avoid deaths. So it is doing it. The advantage with the Johnson & Johnson vaccine is it's one dose only. And the second thing is because it's not an mRNA vaccine, it doesn't need those deep, those deep freeze temperatures that are needed for mRNA vaccines. And it can survive in a refrigerator for several months, which means that places where refrigeration is an issue, this is a great place for use for this. Not everybody can use the Pfizer or the Moderna because of the vaccine storage requirement. So large parts of the world is looking with bated breath for this vaccine to come out.
Okay, you've mentioned some of the benefits for the single-dose vaccine. Do you see it being used with specific groups of people at all?
Right now, it's more in terms of distribution and the logistics of storage of the vaccine. And then there is the special group, which is the ones who had severe or have a history of severe anaphylaxis and don't want to chance the Moderna or the Pfizer vaccine. This is a good vaccine to take. It may not reduce the incidence of infection as reliably as the Pfizer and Moderna vaccines do, but it does protect people against severe disease. And if someone has severe anaphylactic reactions to everything and are walking around with EpiPens, this is a good way of protecting themselves against the virus.
Now, Doctor, once this becomes available, and we assume that it will get the emergency use authorization, will people have a choice as to which vaccine they get?
Yes, that is a plan. That is the reason why we have so many companies. Remember, this is a pandemic. The entire globe needs vaccination. That's why we have so many companies coming out with their vaccines and mass producing it. And hopefully we can cover everybody. So people who have medical issues, the best thing for them to do is go talk to your doctor, find out the different vaccines and what works best for you, and then go after that vaccine. Right now, we're still in the process of rolling out the vaccine, but hopefully in the next coming months, all of them should be easily available, and then you can pick and choose what works best.
Yeah. We do hope that's the case, that they'll all be widely available within a matter of months. Thank you, Dr. Suman Radhakrishna. Appreciate it.
Thank you.